We want to dive into a conversation here concerning Breast Cancer Awareness Month. This is marked every year in October. And as Kenya's leading media house, throughout the month of October, Citizen TV, Royal Media Services has a campaign to really sensitize you as our viewers on cancer and on related issues. And this morning, we want to welcome our guest here. Her name is Dr. Dulcie Wanda. She is a clinical oncologist, and she's here just to shed some light on this particular topic of breast cancer with us this morning. So karibu sana.
Asante
It's
sana.
great to have you here with us. Now, breast cancer is actually the most diagnosed cancer in women here in Kenya. It's said about 7,000 women are diagnosed with breast cancer annually in Kenya, and about 3,000 deaths from this disease every single year. The statistics are quite staggering. Worldwide, it's said that about 1 in 8 women will be diagnosed with cancer in their lifetime. But as far as I understand it, there are also significant medical advancements that have been made over the years. And so these statistics don't have to be as jarring, as terrible as they are right now, do they?
No, they don't. Actually, there's a huge role that we can play if we have better health-seeking behavior. Unfortunately, in Kenya, most of the patients we see are stage 3 and 4, and that's because of the fact that health-seeking is not something we do often. We don't go to hospital unless we're unwell. And breast cancer and any of the cancers, initially, there are no symptoms, and you might not have pain. So it's important to know that we need to go for screening so that we can catch it early, and there's a lot we can do when disease is caught early, as opposed to when it's more advanced, meaning there'll be more treatment options that need to be put in place in order to help the patient to do well. So if screening is entrenched in our practices, if we have a schedule of every year to go for breast cancer screening, every month for the women to examine their breast at least three to 4 days after their menses, then we'll get to a place where we can catch these lesions when it's early. Right. And I think that would do very well and would reduce the numbers, because if we look the statistics in Kenya, like you mentioned, breast cancer still tops the risk. And breast cancer doesn't happen in women alone. We also have men who have breast cancer. Yes, it's a smaller percentage, about 1% of all breast cancers, but we see breast cancer in men, and sometimes it's more aggressive because there's no much tissue for the tumor to grow within. Right. So it's important for both men and women to actually listen to these sessions and do breast examinations so that we can catch the cancers early. I think when the color was chosen pink, it sort of makes the men think this is a female, it's not for us, but right. I hope this is an opportunity for them to also know it can affect them, and it's good to examine their breasts and know of any changes that they've noticed. Don't wait for pain and come for screening. Yeah.
Well, shout out to DJ Gigi, who's even wearing pink too. He's fully in support of this.
I am in support. I'm in the spirit.
Come on. Yeah. Thank you, Gigi. Yeah. But tell us then a bit, because you've talked about screening. At what age should this begin? Because, you know, sometimes we kind of assume that I'm still young, or this is, you know, for our mothers or our grandmothers or our aunties who are a bit more mature in age. Is there a particular age that you now encourage people to go for screening?
So historically, and most of the data we have, breast cancer has been a reserve of those that are above the age of 40. Especially in the West. However, our statistics are very different. We are seeing breast cancer very early. We have 20-year-olds, 26-year-olds who are being discovered with breast cancer. So that just helps us know that breast cancer screening should start as early as possible. And even the lump in a 20-year-old or a 23-year-old should not be considered non-suspect. It's important for you to know that any lump should be examined, and even if it's excised, it should go to the lab so that we can find out, could it be breast cancer? So our statistics and our age for breast cancer are lower than the general population or the West, where it's above the age of 40. So if we do notice a lump in the breast, it's recommended that, yes, the self-breast exam is good, but it's better to have a clinical breast exam. Reason being, sometimes the changes are so subtle, you may not pick them out. But because as health workers, we do a lot of these examinations, then it would be easier for the health worker to pick out such a lesion. So if you're below the age of 40 and would like to examine the breasts below the age of 40 are dense. Meaning something like the mammogram won't work right. So we use an ultrasound, and if we want to do more investigations, then we can do an MRI of the breast. After the age of 40, it is recommended that we do a mammogram. A mammogram is an X-ray of the breast, where the breast is compressed between two paddles and an X-ray is taken. The advantage of this is because even if there is a small line or a small spicule that is not palpable to the hand, then it can be seen by the mammogram. And for those who have caught their cancers that early, it reduces the treatment options that we are able to offer, meaning even the side effect profile becomes a bit less when we catch it even before it becomes a palpable lesion.
Right.
Yeah.
But even as you've talked about health-seeking behavior, and that generally tends to be lacking in our population, part of it is just because of the cost of healthcare in this country is extremely prohibitive for so many.
Yeah.
So in a season like this one, where in a month like this one, where we do mark, you know, Breast Cancer Awareness Month, or even in other times of the year, what really are we looking at, like as far as the cost of getting a mammogram, or should people really just learn to try and do these self-examinations at first, and then also be seeking these clinical examinations? What would you say to that?
I think that's a good question. And I think sometimes the thought that the cost is prohibitive is actually really a cost. In the month of October, just to mark the month and make it a bit affordable and accessible, most corporates, even in the private world, would have a huge discount, sometimes up to half the cost. In the government hospitals, the ranges of the cost has been significantly reduced. So some of the hospitals, I know it ranges between 1,000 to 1,500, and during the month of October it goes even lower. That's just to help people see, because we're talking about it being almost like an annual thing if there is no lesion seen.
Right.
So that means if you target October to be the month you do something about it, one, there'll be a lot that would remind you. There'll be shows like this that will talk about breast cancer.
Yeah.
Secondly, there'll be the discounts that you could take advantage of and get the mammogram screened. And as we look into going into the new insurance policy, the SHA, that talks about universal health coverage, then the cost becomes something of the past, because it means we would have no cost if someone is registered on SHA. And I think part of the barrier, I feel sometimes, is really the worry. What if I have it? And because we've not had so many survivors come out and talk about it, we still have a lot of stigmatization, sometimes self, and also the connotation that cancer is a death sentence, which is a myth, because we have very many breast cancer patients who've done very well.
Yeah.
When we run some of the clinics that are called follow-up clinics, these are patients who are not sick. They just come for screening, they come for checkup, and some were treated in the 2000s, in the 1990s, and they're doing very well. So I guess we need to demystify cancer so that it's not really so scary and someone can be able to go for the screening. Previously, when I worked in the HIV field, I think early in the late 1990s and early 2000s, it was really scary to go for a HIV test. People would literally shake in fear. But over time, because we had the Asuntas, we had people talk about, yes, I'm positive, but I can live, I guess the fear went down. And I think we need to do more of these media campaigns to help people know, one, treatment is accessible in Kenya. The cost is not as high as is postulated. And with the new insurance that would cater for what used to be the heavy burden. Because previously the NHIF would not cater for perhaps would not actually pay at all for screening. Partially it would. Biopsy was not catered for. The histology, looking at the sample under the microscope, was not catered for. So the diagnosis bit was heavy on the patient. But with the new plans that are being rolled out, that should be something of the past. And I think that really helps. And also the psychosocial aspect, because cancer has been seen to be a very lonely journey. Most patients mention they're left by their loved ones, they're left by friends, sometimes not because people are mean, sometimes it's because they don't know what to say. What will I say? How do I make it better? And that makes people pull aside. So when we also cater for the psychosocial aspect, then it becomes very important for the patient, so that we're not just focusing on the medicine and the person within is not doing very well.
So even as we prepare to wind up here, clearly we need to change our habits as Kenyans and become more health-seeking, right? That's being more proactive about our healthcare. Si ngoja tunakunywa tu herbs nyumbani. Hizo miti tunaziponda ponda hivi. Alafu tunakunywa hiyo juice. tunasema sisi ni madaktari. No. By God's grace, science and medicine has advanced so far. And so, of course, then we need to be more proactive about going out and having these clinical examinations. And I think even just conversations like these, even within families, mothers to their daughters, sisters, aunties, let's have these conversations. But maybe as your parting shot, are there certain things that, even as we promote awareness of this, are there certain things that we could be doing in our lives, in our lifestyles, to help improve our chances of not having to get breast cancer? Are there any sort of preventative measures that we could take?
All right, when we talk about risk factors, there are risk factors that are modifiable and some that are not. For example, just being female puts you at a higher risk than being a man. Your age, higher risk. Genetics also play a risk. So if my mother had breast cancer, then I'm at a higher risk than someone who's not had family history. The percentage is low. It's about 10 to 15% for genetics. So currently what a person can do is, one, ensure that you're healthy. Your eating habits are healthy. Obesity is one of the risk factors. So keeping your weight in check. Get to know your BMI versus your height and weight. How much should you weigh? If you're on the higher side, then work on it to get it to where it's right. Avoiding alcohol and cigarette smoking is also something that can be done. Avoiding exposure to radiation that's unnecessary. It's important because when you have radiation exposure, then that could pose as a risk factor. So there are things we can do. And also offering support for those who already have been diagnosed.
Yeah.
And I think Faraja Cancer Center has really, Faraja Cancer Trust has worked very well with cancer patients. They offer psychosocial support. They're able to be there for patients, offer counseling for the patients, and that has gone a long way in helping patients go through the journey. So understanding it's not just about the cancer, there's the person within that treatment journey who needs support is very vital. And I think when we offer them that kind of support, then the treatment becomes holistic. We are not left with a shell of a person after the treatment because of the emotional damage the journey has placed on them.
Indeed.
Yeah.
Dr. Dulcie, it's been a pleasure talking to you. Thank you so much for coming onto the show and shedding some more light for us on breast cancer awareness this month of October. You know, we were talking about the fruit of the Spirit earlier today, even just in this perspective of faith. May goodness be one of those things that we do. Love, joy, peace. I love how you talked about that psychosocial support. That's a way to practice and to put into good use even that fruit of the Spirit as we continue to have this conversation. And so thank you so much for your company here today.